We are here in South Florida, the front line of defense, because we are the public healthcare system. We have here 5 hospitals with 2,000 beds. And as you know, Florida is a very large state. We have like 25 million people. And so far, we don't have the same number of patients as New York, despite the fact that we have a similar number or similar amount of people. My guess is because Florida, is a very spread out. We have a lot of cities. It's not only, so the density of people, the density of the population is not as high as New York. So that's why while in New York there is 20,000 deaths or something, we only get, so it's a lot of deaths anyway, around 700 deaths. But we have been very fortunate. We already passed our peak. It was 4 or 5 days ago. In our healthcare system, in our 5 hospitals, we have 160 patients with the disease, with the COVID disease, and we have, as an average, 50 people on ventilation. And we are very fortunate that we still have a capacity for another probably 50 or 60 patients. And we are very happy that we have passed the peak, so we are not going to be overwhelmed by the virus. The cancer operations have slowed down because we had to focus on this large number of COVID patients. We test every day here in the public more than 700 people every day. That's why all of our resources are doing a lot of testing, but we still probably 50% of our cancer practice is still ongoing, especially people that are under treatment that you cannot stop treatment, chemotherapy, immunotherapy, even oral therapy. We need to monitor these patients in oral therapy. In general, we have a lot of guidelines that we use to treat patients. In the United States, we have been very fortunate because we have guidelines from the American Society of Clinical Oncology. And a lot of these guidelines are common sense. For example, we have teams. Not all the cancer doctors come together to work anymore. Some of us work certain days, other doctors work other days. In that way, if some of us get infected, the other doctors can continue the care, because if all of us do business as usual and there is an infection, the whole office needs to be in quarantine. That's something that we cannot afford. So that's why we work in teams. We screen patients in the front door. Every day when the patients come, they get screened with a questionnaire about, traveling, contacts. They get the temperature measure. We also have sent away all the survivors. The survivors don't need to be seen at this time because they are doing well. So we are only having patients under treatment, intravenous, oral treatment, and patients that need blood. So these are some of the measurements that we have taken. I think very successful, not only in the United States, but in many places in the world. All of us use masks when we see patients. That's also something difficult because I know that in many places of the world there is a shortage of masks. The minimum that we use are surgical masks. When we are in the hospital in contact with COVID patients, we use the 95 mask that gives more protection. And in the hospital, the people that are taking care of COVID patients use full gear, the shield, the mask, the gown, everything. So these are some of the protocols that we're doing for safety of patients and our own safety. Yeah, in the case specific of lung cancer, it's very complicated, as you know, because all of our patients, first of all, have pulmonary conditions because of smoking, like we call COPD in English, and they are always coughing. They are always short of breath because of the cancer or the COPD, and now they are coughing because of the COVID. So it's very. If you want to consider a high risk a patient that is coughing, all of my patients are coughing. So that's why it's very complicated for us. But in general, the measures that we take, history, exposure, temperature, when they come every day to the office, they are very helpful. We also do X-rays. We work for a big hospital system, so we can do an X-ray or even what we call a CAT scan, a tomography in Spanish, at any time. The virus, we still don't know what is the pattern in the X-rays, but there is a lot of reports, more or less how it looks like. The virus looks like some round infiltrates. So we can try to differentiate if my patients are coughing because of pneumonia, and they're coughing because they have fluid in the lungs, or they're coughing because potentially they have the virus. So that's why our care is a little bit more complicated. But the other problem that we have with lung cancer, as you know, is that these patients have a very lethal and aggressive cancer. That's why the lung cancer patients need to be on treatment even during the pandemic. For example, if you have prostate cancer, I can, for your safety, tell you, listen, come back in 3 months. Don't worry, the disease will not progress in these 3 months too much because it's a very slow growing tumor. So come back in 3 months. But lung cancer patients, no, you stop treatment for 3 months, the disease will progress. So that's why that's another challenge that we have with lung cancer. Surgeries in general have stopped unless it's a surgery considered urgent. But in general, even lung cancer surgery have stopped because of the exposure of the surgeons and the personnel to the potential patient. However, surgeries are one of the things that we're hoping to bring back soon. As you know, because we already passed our peak, we're trying to reopen carefully the system. And surgeries are urgent because if a patient has a tumor, we need to take it out before the tumor spreads. And that's something that, for example, needs to be done sooner than later. Radiation therapy is another challenge. Same thing. Sometimes the radiation is urgent. For example, you have a lung cancer with brain tumors, or any cancer with brain tumors. We cannot wait 3 or 4 weeks to give radiation. However, if you have a patient that had surgery, the lung cancer is out, or the breast cancer is out, we can start the radiation either 2 weeks later, or we can start radiation 2 months later. So that's the type of patient that, for her own safety, will say, okay, come back 2 months later because you can start your elective radiation. But when I gave you the other example, the patient with the metastasis, we need to treat them right away, so we have to treat that patient because it's urgent. These are examples of how we can deal with these problems on a daily basis. Well, in general, we can advise our friends and colleagues that first of all, we have to keep treating our cancer patients. We cannot get, there was a lot of panic, that everything is COVID. And as I mentioned before, there are patients like our leukemia patients, our lung cancer patients, that there are cancers that progress very fast. So we can postpone treatment for 3 or 4 months until things are better. So that's why we have to differentiate which cancers are more urgent than the others to treat. And I think that's really important. We are here for our patients. We cannot abandon our cancer patients because also our resources are limited. That's another controversial topic. That there is limited resources. Who do you treat or who don't treat? We have been very fortunate in the United States that we are not running out of resources. Even in New York, as you heard, there is a ship with 1,000 beds that has never been used totally. There is a field hospital with 2,000 beds in the park that was not used totally, despite the fact that we were afraid that they were going to overrun with patients. So that is why we had to be focused and do the best for our patients and keep treating the cancer patients safely. And now that we are reopening many countries, because we have passed the peak, we also have to do it slowly and responsible, because the best example is the Spanish flu. In 1912, that there was a party in Philadelphia because they thought that the flu was gone. And from the party, the thousands of people attended this fair, the flu started again and killed thousands of people. So that's why we have to be very careful also when we reopen and we go back to business as usual.